Hello viewers, welcome to Chungu cha Jamii. I'm your host Eunice Mugo. Today on the show we've prepared a topic on cervical cancer. What is cervical cancer? Why is it that we have it in our society? Do you have the correct information about it? On the show I've invited a guest who is going to help us understand it, and I'd like him to introduce himself. Welcome, guest.
So much. My name is Dr. Kohe Alexander. I'm a consultant obstetrician gynecologist practicing within Nairobi and its environs. And given that it's also Cervical Cancer Awareness Month, I think it's very prudent that you've invited me, and I would love to expound this topic with you.
Welcome so much, Dr. Alexander.
Thank you so much.
So, given that it is the Cervical Cancer Awareness Month,
yes,
what is cervical cancer, to start off?
Basically, when we look at it, cervical cancer is just a cancer that affects the cervix. So if you have basically an agent, in this case, which is the human papilloma virus, so it infects the cells of the cervix, and eventually, if nothing is done about it, it now causes growth of, or transforms the cells of the cervix into what we call malignant cells. So these are cancerous cells which are now able to break off and go and literally infect, I don't use the word infect, but cause damage in other areas of the body. Yes, and that includes your kidney, your brain, your chest. Yes, and all of it just starts in the cervix. Yes.
Wow. How do you know, or how can I tell now that we are talking about cervical cancer? It's mostly in women, because definitely
Yes.
us.
Yes.
So how do I know that I'm affected, or what are the signs and symptoms?
Basically, I always say that, remember, that we have actually determined, and research has shown that the causative agent is the human papilloma virus, and more specifically, specific strains, but the ones which are notorious are the 16 and the 18 strain. So any woman of reproductive age, and let me not say even reproductive age, because now we're having younger sexual debut, but any woman who is sexually active is at risk. So, and the thing is, you can actually range from having no symptoms at all to a whole range of symptoms. So it can even range from now these women who complain and tell you that when they're sexually active with their partner, there's bleeding on after sexual contact. They can actually tell you there's non-specific things like night sweats, weight loss, backache, even randomly having some fractures or bone pain. That will be an indicator that now possibly it's actually more advanced disease. Yes.
When you say sexually active person,
yes,
does that mean it's transmitted, or why is it that when one is sexually active, that is when is at high risk?
Yes, it's actually been shown to be sexually transmitted as more of the cause. Of course, it can also be transmitted through other like contact, but majority, like over 90% of it, is sexually transmitted.
Wow.
Yes.
Given that,
Yes.
you said it can transmit from no symptoms to highly symptoms. So now that I have no information, and
Yes.
I don't know the symptoms, other than now that you've mentioned it, the pains, the bleeding. For a young girl, what are the symptoms that a parent should check out and know this one has to be taken to the hospital for more screening or for more checkups?
For me, I always tell my patients that, number one, they should learn to prioritize their own health. So the minute that you become sexually active, I tell my clients that just like your birthdays every single year, you should actually learn to take charge of your health, and more so your reproductive health. So the minute someone starts being sexually active or is planning to be sexually active, they should actually schedule a visit with their reproductive health provider. In this case, if it's a gynecologist, a doctor, a clinical officer, or even a nurse, so that they can be able to now give them like their risk profile. Because again, when we look at this cancer, there are various risk factors. As I said, like for example, if you've had debut of, if you've started having sex early, or if you have multiple sexual partners, or if you've had like multiple sexually transmitted infections, that is like gonorrhea, chlamydia. Again, also if you're using oral contraceptive pills, because it's been shown that they work by, one of the side effects is that it turns the cells of the cervix inside out, so it causes a wider surface area for exposure. and of course if you're also at any level of immunosuppression. So that means that these are the clients that at least the healthcare provider will be able to tease out and know that you're at high risk, and then be able to now proceed to now subsequently screen and tell you which modality is most suitable for you. Yeah.
Do you have an age bracket per se that it's on high risk, and why is the age bracket on high risk?
So basically, of course, the ones who start having sex early, because it means it's just more longer exposure to the virus, because it's a virus. So the more you keep on getting exposed, the higher the risks of infection. But it's actually been shown that most women who actually exposed to it are able to, especially in their early years, to clear. Because if you just take a sample of like most of the women in the early 20s, and you do a cervical sample of their cervix, you'll find that at some point they've had an HPV infection and it has cleared. But again, as I told you, there are those ones who are at higher risk, what I've just alluded to previously. So if they meet any of that criteria, those are the ones who need to be they need to be at least secluded, and then proceeded, that at least you identify that group and help them proceed for further screening and further testing. Yes.
Given that, and I've noted a lot of people are not informed about this kind of cancer or the awareness of it.
Yes.
So what are the basic information that the people should have out there about this cervical cancer? So
basically, number one, the whole point is that one, as I always say, there are 4 tiers. One, prevent yourself from getting that HPV, because as we've said, HPV is the one that leads to the cancer, especially those strains that I mentioned. So the first thing, prevent yourself. And how do you prevent yourself? As much as possible, delay your sexual debut. So until you're ready, until you're mature, and this is because it gives time for the body to mature and be ready, and at least you'll even have, now you don't have the at-risk teenagers and those young girls being exposed. Number 2, if you cannot do that, that's where we come and say, even if they're exposed to it, prevent the infection. And this is where now, as we said, I think I'm jumping the gun a little bit, but this is where we'll start talking about things like vaccination strategies. Like this is why, like, even the government rolling out a program to vaccinate young girls, and I still think they should add the young boys as well, because the girls just don't get the papilloma virus by themselves. It's picked from somewhere. So they should, in my opinion, they should also start roping in the young boys into the program. Then after that, if you're sexually active and you've already been exposed to the human papilloma virus, now we come to the screening. There are various methods of screening. So this is where we should be able to look at a patient and just test. Is your cervix looking like it's having signs and symptoms of an infection? And if it is, how do we prevent it? Because the beauty about cervical cancer, I know it's an oxymoron, but the beauty about it is that it takes a while. So by the time you get an infection, it takes actually about 10 to 15 to 20 years before now you get full-blown invasive cancer. So by that time, even if you have an infection, a lot can be done. And if we screen you, we look at your cells and we see that these cells don't look normal, a lot can be done in between and preventing you or reduce your chances of getting invasive cancer. Yeah.
Okay, you've mentioned about prolonging your years of being sexually active.
Yes.
Now, lately we have, in the current society, we have teenage being exposed into sex.
Yes.
So when you say you take long before you get exposed into sex, or wait until you're ready, can you put maybe an age number in it or something?
You know, it will be a bit difficult because you have to look at various socio-cultural functioning and also conditioning. Because again, you can't give like a magic number and say 18, 21, 24, 25. The most important thing is to pick these at-risk girls and boys and to educate them. You know, my issue is that we don't educate them. So by the time they get exposed, they don't know what they're getting exposed to. So if we are able to tell them that these are and especially and inculcate this into their syllabus at school, they'll be able to learn that these are the risks of having sex too early, so that by the time they'll be able to make a conscious decision and think that, I'm going to expose myself to this. Am I ready? And can I deal with the consequences of that exposure? Yeah.
Given say that a lot of people don't have information out there, which is so true. Do you have maybe an organization or a strategy in which you go out making this information known to the young girls, to the young boys, to the society at large, is there any forum or any way that you go about informing others?
Of course, like this is why I love the advent of what social media has enabled us to do, especially during the COVID times. Because when we were locked in, we had to come up with creative measures of now disseminating this information. So that now, if we look at our society, the Kenya Obstetrics and Gynecology Society, just recently we've actually released a video in various mother tongue languages where and ethnic languages around across the country where people are able to understand. Because even now, maybe I'm talking, someone's like, I don't understand English. What is he saying? So they are able to understand in their own local dialect and able to get the core messages. Like there's a core message that's being spread. Number two, we also, myself and other gynaes are able to, we have our own social media pages. Like I have on my page, I'm doing a series, just in a simplified series on cervical cancer, what to look out for, who are the people at risk. If you get, like now you're screened and you're told there's something abnormal, what to do next. If you find that you have cervical cancer, what does it mean? What are the treatment modalities? What are the outcomes and the prognosis? How do we prevent it? So a lot of us are doing that on the various social media spaces and also various media channels. So we are doing that, and especially given that this is Cervical Cancer Awareness Month, we are literally running away with it. Yeah.
That is so good and so encouraging.
Yeah.
You've also mentioned something to do with once you give out the information also on the age bracket now, given all that in one plate, you've said that you should also bring boys on board.
Yes.
Maybe putting out on the government, since it's them that doing the vaccine and rolling out the vaccination.
Yeah.
When you're talking to your patients, when the boys or to a parent at large, do you also tell them to look out for the boy child? Or?
And I'm happy that even this is coming, because if you look at, even recently at what our second lady was saying, she was talking about how the boy child has been neglected, and this is how it's cutting across in various spheres. Because right now we are focusing so much on, okay, yes, prevent, because of our girls and our ladies are the ones who are going to get the cervical cancer. But actually, if we target the young men, the young boys, that is the key that we're beginning to see. That if we just are able to reach out to them and give more resources and apply more resources and take more time in highlighting this disease and the prevention of this disease, I'm sure we're going to make a lot of headway in prevention of cervical cancer.
Oh,
yes.
That is so good.
Yeah.
Another thing that you had mentioned, you said that it takes time for it to show.
Yes.
You've said 5, 10, 15 years.
Yes.
My question comes in, we have a lot of, how do you call it, UTIs, infection with ladies.
Yes.
Mostly they're the one who are affected.
Yes.
Every time that you're going for checkup, you'll find that you're being told you have an UTI. And this other infection called candidiasis.
Yes.
Does this lead to one who is armed to having this infection recurring? Are they the people who are at the high risk of getting these cancers?
Okay, now I want to clarify something, because I have a lot of patients, and I'm sure my colleagues also see this, who, with our female patients, who get it a bit confused. So there's a difference between a UTI, because UTI means the urinary tract, so that's where urine comes from. Then there is now like candidiasis, which means that there's an inflammation or there's an issue with the vagina. Then now we're talking about the cervix. So we're talking about now the things that will put you at risk of getting now cancer are infections around the cervix. So anything that will inflame or cause damage to the cervical tissue is what will now put you at risk. So that's why we mean like sexually transmitted infections, because those are the ones that ascend into the vagina and then into the cervix. Once they go into the cervix, remember that actually cervical cancer happens, or where it starts, the origin of where it starts developing is that the junction, the cervix has 2 layers. There's some, I don't want to go into so much technical what have you, but it's a junction in the middle of the cervix. So there is where the exposure of this HPV goes to, and HPV would love it so much when now there's inflammation, because it means there's erosion of that layer. So that layer is actually quite inflamed. So infection is easier. So that's why we said that when you're having current sexually transmitted infection or cervicitis, what we say, so that is gonorrhea, chlamydia, HIV. Those are the things that now will lead to a faster like it'll hasten the progression of the disease. Yes.
When you say the UTIs,
Yes.
How do you tell that one has UTI? Can you tell of the signs and symptoms before you go even for the checkup? Because one may not know. Maybe trusting this one person,
Yeah.
and the other person is not to be trusted. Or maybe it's me with the problem from this person to the other person to the other person. And not knowing, because I'm just saying maybe it's normal for maybe the discharge or maybe the itching or so. How do I tell that I'm infected or I'm at risk of being infected, other than being active now? I'm active, yes, but with the proper information of the symptoms, and for me to now go to the hospital for further checkups. What are the symptoms for these UTIs?
So basically, again, this is why I wanted to correct you. It's not UTI, but STI.
Sorry, yes, STI.
So for the STIs, if a patient comes to you and tells you that, for example, I'm having, the first sign usually is like, it can actually, like, let me start again, can range from no signs at all to a myriad of signs.
Okay.
So most of them will tell you, okay, maybe I'm having like a foul smelling discharge. That is not normal, because every woman, depending on her cycle, will have some discharge. Some days there are no discharge, some days it will range, but they tell you that, one, it's a funny smell. Number two, the color, anything that is yellow-green is not normal. They'll also tell you that possibly I'm having I'm spotting or I'm bleeding in between my period, which we call intermenstrual bleeding. So you bleed in between the days that you expect to have your menses. So if your menses end today, and if you expect it on a specific day, and in between those days you're bleeding or you're spotting, that can also be another sign. Or you're having, for some women, if it's very pronounced, they could even have like a fever, what we call a low-grade fever. They're just feeling like, I'm feeling a bit off, like I'm having fever. So those are the signs that tell us that now you are having a STI. So of course you need to come to the office, and then we check you out. We need to also do an abdominal exam, check your breasts. But then the most important thing is that when we look down there, any specialist or any healthcare provider should take what we call a speculum and look. Put it inside the vaginal canal, open and see. Then usually you will tend to see a very inflamed cervix. It actually looks like a strawberry, very red, inflamed. It could be having a bit of some discharge around there. That will tell us that obviously you're having an STI. And then, of course, prompt treatment is important. Also, the thing is, when you're treating STIs, you have to treat the partner, because most of the time we treat the patient, but we always forget that there is someone who was maybe propagating. So you treat our patient, then she comes back again. And you see again the recurrence. That's why, remember the risk factor? Going back to the risk factor, recurrent infection. So you find that she comes back again with an infection, again predisposing her. Then again, we talked about number of sexual partners. Maybe she's with this partner, who's with this partner, who's with this partner. Yes, so you're just, HPV is just being propagated.
Okay.
Yes.
Viewers, I hope you're learning a lot, like I am, understanding that there is a difference between UTI and STD infections, and also knowing that once you're having recurrent STD infections, you're at high risk of getting cervical cancer. We'll take a break and we'll come back with Dr. Alexander to learn more about cervical cancer. Continue sending in your question, your comments across all our social media networks. That's GBS TV Africa. Our SMS line is 21144. We'll be back shortly.